Hello, and welcome to the Damal Consult Career Academy. In today's video, we're diving into an important topic for those aspiring to become mental health nurses in the NHS. We'll be exploring common interview questions and providing detailed answers to help you prepare for your interview with confidence. Whether you're just starting your nursing career or looking to make a transition into mental health nursing, this guide will give you the insights you need to stand out. So, make sure you stay tuned and take notes as we walk through the essential questions and ideal responses for your NHS mental health nurse interview. 1. Can you tell us about your experience in mental health nursing? I have 5 years of experience working in mental health nursing, during which I've had the opportunity to work with diverse patient populations facing a range of mental health conditions, including depression, anxiety disorders, schizophrenia, and substance use disorders. In my previous role at Tate Hospital, I focused on assessing patients' mental health needs, developing individualized care plans, and collaborating with multidisciplinary teams to provide holistic care. One of my key responsibilities was crisis intervention, where I managed situations requiring de-escalation and immediate care. For instance, I successfully supported a patient experiencing acute psychosis by employing therapeutic communication techniques, which helped stabilize their condition. I also prioritize patient education and advocacy, ensuring individuals and their families are well informed about treatment plans and community resources. Additionally, I have experience administering medications, monitoring side effects, and maintaining detailed documentation to ensure compliance with legal and ethical standards. Overall, my experience has strengthened my ability to build rapport with patients, maintain professionalism under pressure, and provide empathetic, patient-centered care. I am excited about the opportunity to bring these skills to your team and continue making a positive impact in mental health nursing. 2. How do you handle challenging or aggressive behavior from patients? Handling challenging or aggressive behavior from patients requires a calm, patient, and professional approach to ensure everyone's safety. My first step is always to use verbal de-escalation techniques, speaking in a calm and non-confrontational tone, maintaining open body language, and actively listening to understand the patient's concerns. I strive to identify potential triggers for the behavior, whether it's frustration, fear, or an unmet need, and address those issues appropriately. I adhere strictly to NHS guidelines and policies for managing aggressive behavior, ensuring that I involve additional support or follow protocols when necessary to protect both the patient and those around them. After the situation has de-escalated, I focus on rebuilding trust with the patient by showing empathy and emphasizing that my role is to support them. Finally, I reflect on the incident, document it thoroughly, and collaborate with the team to evaluate what can be learned to improve future care. For example, in a previous role, I worked with a patient who became agitated due to confusion and overstimulation. By calmly redirecting their focus, reducing environmental stressors, and involving them in small decisions, I successfully diffused the situation and prevented escalation. 3. What are the key principles of the Mental Health Act, and how do you apply them in practice? The key principles of the Mental Health Act (MA) are designed to protect the rights and well-being of individuals experiencing mental health challenges. Here's how you can approach this question. Key principles of the Mental Health Act. 1. Least restrictive option. Interventions should impose the minimum restriction necessary to achieve the desired outcomes. 2. Respect and dignity. All actions should respect the rights, dignity, and autonomy of individuals. 3. Patient participation. Patients should be involved in decisions about their care and treatment wherever possible. 4. Purpose and effectiveness. Interventions should be in the patient's best interest and aim to improve their health or safety. 5. Reciprocity. Patients receiving compulsory treatment should also be provided with appropriate support to address their needs. 6. Equality. Care and treatment should not discriminate and should be tailored to the individual's specific needs. How to apply these principles in practice? 1. Least restrictivation. Example, always aim to explore less restrictive alternatives, such as engaging the patient in voluntary treatment or community-based services, before considering detention under the Mental Health Act. 2. Respect and dignity. Ensure that patients are treated with compassion and understanding, addressing them by their preferred names and respecting their cultural and personal preferences. 3. Patient participation. Example, I actively involve patients in their care plans, encouraging them to voice their concerns and preferences, and ensuring they understand the proposed interventions. 4. Purpose and effectiveness. Example, when considering interventions, I evaluate whether they are clinically justified and focus on improving the patient's mental health and overall safety. 5. Reciprocity. Example, for patients subject to compulsory treatment, I advocate for access to the appropriate therapeutic, social, and legal support to meet their needs holistically. 6. Equality. Example, I am conscious of the diverse backgrounds of patients and work to provide equitable care, ensuring individual needs are met regardless of age, gender, culture, or socio-economic background. The principles of the Mental Health Act guide me to provide care that is compassionate, patient-centered, and respectful of individual rights, ensuring that interventions are both effective and proportionate to the situation. By adhering to these principles, I aim to empower patients and foster their recovery in the least restrictive and most dignified way possible. Before we proceed further in this video, I want to share something that could be a game changer for anyone preparing for a mental health nurse interview. If you've been feeling unsure about how to answer those tough interview questions or how to make a lasting impression, then this is for you. Our ebook, 100 Mental Health Nurse Interview Questions and Answers, is the ultimate guide to help you ace your interview and land your dream job. It's packed with the most commonly asked questions and professional answers that are guaranteed to set you apart from other candidates. And here's the best part, bonus, you'll also get free expert tips on how to pass the interview and master the STAR approach to answering behavioral questions with confidence and precision. It's super affordable, and we're currently offering an exclusive 50% discount for a limited time. To get your copy, click the sealer or fourth wall link in the description box below and start preparing like a pro. Need more details? You can chat with our online customer care representative on WhatsApp or email us. Don't miss this opportunity to boost your confidence and secure your dream role. Now, let's get back to the video and dive into even more tips to help you succeed in your mental health nurse interview. 4. How do you assess and manage risk in mental health patients? Assessing and managing risk in mental health patients is a critical part of being an NHS mental health nurse. Here's how I approach it. 1. Comprehensive risk assessment. I start by conducting a thorough risk assessment, using established tools like the Risk Assessment Matrix or START short-term assessment of risk and treatability. This involves gathering detailed information about the patient's history, current mental state, and environmental factors. I also assess for potential risks, including self-harm, harm to others, neglect, or vulnerability. 2. Collaborative approach. I work closely with the multidisciplinary team, the patient, and their family or caregivers to gain a holistic understanding of the patient's circumstances. Involving the patient empowers them to share their thoughts and feelings, which is crucial for accurate risk evaluation. 3. Dynamic risk monitoring. Risks can change quickly in mental health. I continuously monitor the patient's behavior, mood, and responses to treatment. Regular reviews ensure that any changes are identified early and addressed promptly. 4. Developing a risk management plan based on the assessment. I create an individualized risk management plan that outlines specific interventions, coping strategies, and support systems. This might include safety planning, crisis intervention measures, or referrals to specialist services. 5. Promoting de-escalation techniques. I utilize de-escalation techniques to manage situations where the patient may become distressed or agitated. This includes maintaining a calm demeanor, active listening, and using non-confrontational communication. 6. Documentation and communication. I ensure that all assessments and interventions are meticulously documented and communicated clearly with the multidisciplinary team. This ensures continuity of care and enables informed decision-making. 7. Balancing safety and autonomy. While managing risk, I prioritize maintaining the patient's dignity and autonomy, working to strike a balance between safeguarding them and empowering their independence. By using these steps, I aim to provide a safe, supportive, and effective care environment that reduces risk while promoting recovery and well-being. 5. Can you describe a time when you worked as part of a multidisciplinary team? In my previous role as a mental health nurse, I worked with a patient experiencing severe anxiety and depression, which was significantly impacting their daily functioning. The goal was to create a holistic care plan that addressed their mental health, physical health, and social needs, requiring collaboration with the psychiatrist, social worker, occupational therapist, and the patient's GP. I actively participated in weekly multidisciplinary team meetings, sharing updates from my one-on-one sessions with the patient, such as their response to treatment and any emerging challenges. I worked closely with the social worker to connect the patient to community support services, and collaborated with the occupational therapist to develop strategies for managing daily tasks. As a result of our collaborative efforts, the patient showed significant improvement, becoming more engaged in therapy and gradually reintegrating into their community. This experience highlighted the value of teamwork in delivering seamless, patient-centered care. 6. How do you maintain your own mental health and well-being while working in this demanding field? Maintaining my mental health and well-being is a top priority for me, as I recognize how essential it is to provide high-quality care to others. I achieve this by ensuring a healthy work-life balance, setting clear boundaries between my personal and professional life. Regular exercise, a nutritious diet, and sufficient sleep are part of my routine to stay physically and mentally resilient. I also practice mindfulness and relaxation techniques, such as meditation and breathing exercises, to manage stress effectively. Reflective practice is another important tool I use to process challenging situations and learn from them without holding onto emotional burdens. In addition, I actively seek support from my colleagues and supervisors through regular peer discussions and supervision, which provide valuable insights and emotional backing. I maintain strong connections with friends and family outside of work, which helps me recharge and gain perspective. Professional development is another key aspect of my self-care. Attending training sessions and workshops on stress management and resilience keeps me prepared to handle the demands of the job. Finally, I am open to seeking help from employee assistance programs or mental health professionals when necessary, as I believe this demonstrates strength and a commitment to staying at my best for both myself and my patients. These strategies enable me to remain effective, compassionate, and balanced in this demanding but rewarding field. 7. What strategies do you use to build trust with patients who may be reluctant to engage in care? Building trust with patients who may be reluctant to engage in care is a process that requires patience, empathy, and consistency. I start by creating a safe and non-judgmental environment where patients feel comfortable and respected. I make sure to actively listen to their concerns, validating their feelings and showing genuine interest in their experiences. I understand that building rapport often takes time, so I begin with light, non-threatening conversations to establish a connection before moving on to deeper issues. I also involve patients in their care decisions, empowering them to be part of the goal-setting process and respecting their preferences. Consistency is key, so I ensure I follow through on my commitments, maintain punctuality, and always act professionally to build trust over time. I recognize that every patient is unique, so I adapt my approach to meet their individual needs, which may include using creative techniques like art or activities to connect with them. When appropriate, I also collaborate with family or other trusted individuals in the patient's support system to help build trust. By focusing on these strategies, I aim to meet patients where they are and gradually foster a relationship that encourages engagement and leads to positive outcomes. 8. How do you stay updated with current best practices in mental health care? When answering the question, how do you stay updated with current best practices in mental health care? In an NHS Mental Health Nurse interview, you can highlight your commitment to ongoing professional development and your proactive approach to learning. Here's an example where I stay updated with current best practices in mental health care by engaging in a variety of methods. Firstly, I regularly attend training sessions and workshops provided by the NHS and other reputable organizations. These sessions cover the latest evidence-based practices and guidelines in mental health care. I also subscribe to professional journals and publications, such as the Journal of Psychiatric and Mental Health Nursing and the British Journal of Psychiatry, which keep me informed about new research, treatment approaches, and case studies. Additionally, I participate in online forums and attend webinars focused on mental health care. Networking with colleagues, both within and outside the NHS, also provides an opportunity to share knowledge and best practices. Finally, I make a point of seeking feedback from colleagues and clients to evaluate and improve my own practice, ensuring that I provide the highest standard of care based on the latest developments in the field. 9. Can you discuss a situation where you had to make a difficult decision regarding a patient's care? In a previous role, I was working with a patient who had a history of severe depression and suicidal ideation. One day, the patient expressed that they were feeling hopeless and had thoughts of harming themselves. I had to decide whether to respect their request for privacy and confidentiality or to break confidentiality to ensure their safety. After assessing the situation, I felt that the risk of harm outweighed the need for privacy. I consulted with the senior nurse and the multidisciplinary team and decided to implement a safety plan, which included monitoring the patient more closely and involving their family in their care plan. While this was a difficult decision, I focused on the patient's safety and well-being, as well as adhering to the ethical and legal obligations I have as a mental health nurse. Ultimately, the decision was the right one because the patient's condition improved with the added support, and they were grateful for the intervention. It was a challenging situation, but it reinforced the importance of collaborative decision-making, patient-centered care, and maintaining the safety of those under our care. 10. How do you ensure the dignity and respect of patients while providing care? Ensuring the dignity and respect of patients is fundamental to providing high-quality care. I approach this by treating every patient as an individual, recognizing their unique needs, preferences, and circumstances. First and foremost, I listen actively and empathetically, allowing patients to express their thoughts, feelings, and concerns without interruption. This helps build trust and shows respect for their autonomy. I always involve patients in their care planning, making sure they understand their options and feel empowered to make decisions about their treatment. I also prioritize maintaining patient privacy and confidentiality at all times, ensuring that sensitive information is shared only with those directly involved in their care. In addition, I am mindful of nonverbal communication, as body language and tone can significantly impact a patient's sense of dignity. I make an effort to be compassionate, patient, and supportive, ensuring the environment is one where patients feel valued and respected. Ultimately, Respecting a patient's dignity is about creating a therapeutic, inclusive environment where they feel safe, heard, and cared for, which promotes their overall well-being and recovery. Do you have any questions for us? When asked, "Do you have any questions for us?" in an NHS mental health nurse interview, it's important to ask questions that show your interest in the role and organization, as well as your dedication to providing the best care. Here are some thoughtful questions you can ask. 1. Can you describe the team I will be working with and how the multidisciplinary approach works in this setting? 2. What are the most common mental health conditions or challenges that patients face in this role? 3. How do you support staff in managing the emotional and psychological challenges of working in mental health care? 4. What types of training and development opportunities do you offer for mental health nurses? 5. How do you ensure the well-being of staff and manage burnout in a high-pressure environment like mental health care? 6. What tools or resources are available to mental health nurses to support patient care and treatment plans? 7. How does the NHS support mental health nurses in their career progression or continuing education? 8. How do you measure success in this role, and what would be expected of me in the first 6 months? 9. Can you tell me about the support systems in place for patients transitioning out of care or into the community? 10. How does the NHS ensure a collaborative approach to mental health care between nurses, doctors, and other healthcare professionals? These questions reflect your understanding of the role and your commitment to providing high-quality care to patients. Thank you so much for watching. I hope these NHS mental health nurse interview questions and answers have provided you with valuable insights and tips for your own interview preparation. Remember, the key to success is showing both your expertise and your passion for mental health nursing. If you found this video helpful, don't forget to like, subscribe, and share it with others who might benefit. Also, feel free to leave any questions or comments below. We'd love to hear from you. Good luck with your interview, and well, see you in the next video from Damal Consult Career Academy.